Thank you. This is an absolute delight to be here. I stand before you with two qualifications. One, I've been honored to be governor, but two, I am proudly a senior citizen. And I have been certified by this because I walked into Sherry's restaurant during the campaign up in Bellingham, and they said, "Sir, would you like your senior's discount?" And I thought, man, I've arrived. So I am here. I'm here happily married to a woman who was cute at age 16, but now is beautiful at 62, is Trudy Inslee. She's here today. Trudy, thanks for being a senior citizen. I got to express a little disagreement with Charlie, though, because I know he's the most esteemed person on these subjects, but he described this as we're going to be hit by a wave of senior citizens. I disagree a little bit with that. I think we're going to be hit by a bunch of senior citizens surfing on the wave. That's the way I look at this. And with the new health care plan we've got, I think that's going to be the case. Well, today I'm as excited to be here on a historic day. It is historic because we're looking at this as a very optimistic position in the state of Washington to people aged in no better place in the world to become older than in the state of Washington. And second, it's historic because this is the first day of open enrollment for our health care reform plan. And that's something to celebrate. Well, it is a matter that's historic. You know, what Harry Truman started over a half a century ago, we have now brought to fruition right here in the state of Washington on October 1st, 2013, to make sure health care is truly available to everyone in our state. Hundreds of thousands of Washingtonians can now compare plans and sign up for health care coverage to meet their individual family needs. And let me begin by thanking ARP, Ingrid, and the fabulous sponsorship of the organizing committee of this group, including representatives of SEIU, the Washington Area Agencies on Aging, the State Council on Aging, and many others. You've done a great job up to this point, convening an effort to really get us off to a new start. So it's going to be a successful and informative day. I won't be able to join you for the whole day. We've got some other work to do as well in the state of Washington. But I know we're here and we all share the same goals. These goals are to improve and enhance the lives of Washington's senior citizens, and to improve and enhance the health of Washington's communities. Now, in addition to being governor, I also happen to be a grandfather. So I'm part of a demographic that is the focus of today's summit. And Trudy and I, as we age, we're looking out for our aging parents as well. Trudy and I are very lucky. My dad's living the high life in Lopez Island, a tough veteran of World War II, and Trudy's mom is just doing great in Seattle at age, I won't mention it. It is a healthy age that she has got, and man, is she sharp. ARP said Washington State offers some of the best long-term care for seniors in the entire nation. And that's despite the impact of the Great Recession, that we've been able to, in fact, to continue on that legacy. In fact, ARP ranks us as second among states in the entire country for the scope of our long-term care system. We give seniors more in-home and adult family care than almost any other state. And that's good, because for us, it's about choice and dignity, and we provide a boatload of both in our state. And we save money by doing it. And that savings goes right back into care. Because we've used our funding wisely, ARP ranks our state among the most generous states in the union in providing personal care services. These are the things that really do improve seniors' lot in life. To allow basic care and activities like dressing, bathing, eating, grooming, cooking, housekeeping, and shopping, what it means to be alive and to live independently. I've seen for myself the differences that these services make in the lives of real people in our state. I spent the day with home care provider Sherry Hunter and her client Phyllis Green down in Renton. Sherry Hunter is a proud SEIU member, and I saw what her work did. It enabled Phyllis to remain in her own home. And instead of going to a nursing home, she now has the independence and a better quality of life. And I also saw something that was pretty cool. I saw two friends. I saw Sherry and a friend and a client that were friends. And I like to think that we provide friendship for a lot of senior citizens. That's not a bad thing as well. And that's a choice I want Washington seniors to continue to have. And in the years to come, we're going to work to make sure that our long-term care system not only survives, but gets even better. I'm glad that we were finally able to give our state's long-term care workers a raise this year, their first since 2008, and I believe they deserve it. Here's something else we can be proud of in our state. We were the second state in the nation to win federal approval for our health care dual eligible solution, which of course are seniors or those with disabilities who are covered under both Medicare and Medicaid. We're taking the bureaucracy and paperwork out of health care and putting the focus on where it belongs, which is on patient care. By bringing these two programs together, 30,000 of our most vulnerable citizens receive coordinated quality care with a focus on coordination and social supports under a single integrated plan. And we hope that eventually all 115,000 of our dual eligibles will receive this care. It's part of making Washington an age-friendly place to live, as well as a friendly place to age. This is an opportunity for our state to do groundbreaking work in our communities, and we're doing that. We ought to feel good about what we're doing because we are leading the nation. And this takes some creativity and innovation. And I want to thank everybody on this team to, in fact, to be doing that. So we've been working to seize that opportunity. Here are three more important things our state has recently accomplished. One, we've expanded funding for the Housing Trust Fund so we can do a better job of meeting the needs of our citizens with low-income and special needs, including seniors. Second, we passed a well-funded licensing and inspection program for adult family homes, which means much safer conditions for residents who live in these homes. And safety has to be first, and it is a concern, it should be. And three, we made it possible to offer pre-Medicare seniors a prescription drug discount card, saving them up to 60% in prescription drug costs. In fact, our enrollment numbers have shown that older Washingtonians waiting to get on Medicare are the primary users of this card. Now, it may take a village to raise a child, but it takes many villages across our entire state to make sure that our aging population are treated with both competence and compassion. And I want to make this point. I think it's important for us in this community to think about this for a moment. We know we have a very large unmet need for the education of our children. As you know, we're in the state order to produce $4 billion plus for our K-12 system. There's a right way to finance our schools, and there's a wrong way to finance our schools. I think the wrong way is to attempt to finance it on the backs of senior citizens and the least amongst us in the state of Washington. I take pride that this year we put $1 billion on a bipartisan basis into our K-12 system without reducing services for housing for senior citizens and the least amongst us. That's an accomplishment we ought to be proud of in the state of Washington. Dr. Carstensen will talk about in a few moments. We do know the numbers, the demographic numbers that are headed our way. And we need our most innovative thinkers to delve into this important issue in facing our society as the boomers age. And I'm glad many of these innovative thinkers are here today to put their creative juices to work. Now, speaking of taking the village, I also want to mention what a great job our area agencies on agencies, or AAAs, are doing in communities across our state. These local organizations really do develop and really do provide the services where the rubber meets the road. And I've seen this make such a difference for so many families. Washington State has 13 of these agencies that comprise county governments, regional councils, and tribes. And as governor, I'm committed to making sure these programs continue to be terrific community-based resource centers. Now, everyone here agrees that the last few years have been very challenging. There's been cuts of an unprecedented, and this is something I don't think people really realize, there have been unprecedented cuts of $11 billion in state spending since the Great Recession. Our ability to meet even the core needs of Washingtonians has really been tested, from funding our schools, our higher education facilities, to maintaining public safety, protecting the most vulnerable in our communities. And while there are still some fiscal challenges ahead, the days of balancing the budget, pitting one critical service against another, are over. Now, our economy is starting to bounce back. Recovery is underway. We're starting to build a working Washington that's moving us in the right direction. It would be wonderful if Washington, D.C. got the message that we'd like our economy to recover, actually. At the moment, that message has not been received. So we need to start building a working Washington, and that's moving us in the right direction. And that means fully embracing health care reform in our state. It's always been a part of our plan for a working Washington. When the U.S. Supreme Court upheld the Affordable Care Act, it was great news for our state, and great news for the millions of Americans across the country who've already benefited, including our senior citizens. Take a minute to think what we've already achieved. Remember the donut hole that we all heard so much about? It's finally closed. We have more than 60,000 seniors in our state who will continue to save $600 on average on their prescription drugs. And seniors will continue to receive free wellness care. This is a pretty good thing that Obamacare has already delivered on. I'm happy that we moved the ball in this regard. But the Affordable Care Act won't just benefit seniors. It's good for our kids and our grandkids too. It's good for over 50,000 young adults in our state who will have access to insurance coverage under their parents' plan. It's good for people for all ages who have pre-existing condition and will no longer be denied coverage. And it's good for our state's innovators and entrepreneurs who will be free to launch their own businesses instead of being stuck in jobs they don't like just because they got to get health care. This is freeing people to pursue their own destiny and not be shackled by the bonds of a health care plan. The list goes on. Insurance companies will no longer have the power just to cancel your policy. They can no longer charge women more than men, and there are no more lifetime maximums. Now, we still have our work cut out for us, but here in Washington State, we are leaders in health care reform, and it have been for 2 decades. Other states have been watching and grabbing onto our ideas for years. I believe the Affordable Care Act will help eliminate waste in our health care system, and that will mean better care for all, including seniors in Medicare and Medicaid. And I just want to say this. When people see the benefits of this plan, when they understand the savings, when they see their children getting on their parents' plans, when they understand the donut hole has been filled, when they start to sign up as they are today for our plans, there is no going back in Washington State, and there is no going back in the United States of America. We did not let them repeal Social Security. We did not let them repeal Medicare, and this will not be repealed. We're moving forward in this state. One of the reasons this is important is that currently 90% of our health care dollars are spent on care, and only 5 to 10% are spent on prevention and illness. We can do better than that, and the health care reform is going to help us do better than that. So let's take advantage of this historic day and share ideas as we plan for Washington's future. I'd like to see what more we can do to prepare for end-of-life care. People should have a good conversation about their wishes, so I'm glad that's on the agenda to discuss today. We want people to be in control of their own destiny, of their own dignity. And I have some other ideas I'd like to share with you I hope that you'll consider and talk about today. I'd like to talk about engaging people's talents in our communities. 90% of baby boomers want to keep living in their own communities as they age, near their families. They don't necessarily want to go to Florida or Arizona, where it's excruciatingly hot. They want to stay right here. It's critical we plan for intergenerational living, and I think this is a new thing that we're seeing happen organically, that we policymakers need to start to think about how we accommodate decisions that families with multiple generations are now making. And that means we need livable communities that are bike and pedestrian friendly, and that have affordable public transportation options for all of us, particularly senior citizens. We need more affordable housing options that are more flexible. And we need to help people stay healthier longer so they can enjoy the golden years of their lives and remain active in their communities. And here's something I hope that you and we can have a first day of talking about a conversation. I'd like you to help me to think about ideas of how we can really foster volunteerism amongst our senior citizens. We have this incredible talent pool of retired Boeing engineers and retired teachers and retired construction personnel who've had this lifetime of experience, who now at age 70 and 74 and 76 are incredibly healthy and active and energetic because of the advances of nutrition and healthcare. This is a group of people that I think we need to help find a way to use their talents in our communities in a second or third career. May not be one that's paid, but it's one that can allow people to do what they want to do. This is a time of life where people can engage some new way to be engaged in their communities. And I think it's something we should help foster and be proud of. And I'd love to hear your thoughts about what more we can do to connect senior citizens with the needs of their communities. I think there's a huge untapped pool for us if we help people find opportunities for them to be engaged in their communities with just a little nudge or just a little idea. Think about all those kids out right now struggling with sophomore math that could have a little help maybe from a retired Boeing engineer somewhere. I think there's a lot we can do in this sphere, and I'd like you to help me think of some ideas in this regard. So I'm looking forward to hearing your strategies. It's going to come out of today's work. We've got a lot to do. We aren't getting any younger, so let's get to work with this meeting. Thanks very much. Good luck.